Thank you, Prof. Saiful. Thank you, Malaysian Associations of Education in Medical and Health Sciences, for providing this platform for scholars to present and share thoughts. Good afternoon, everyone. I'm Foong, lecturer at the Faculty of Medicine, University Malaya, and today I will present my research about high versus low achieving preclinical medical students, what makes them different. Okay, this research was published in Annals of Medicine in 2022, and I would like to introduce my core researchers, and they are Ms. Liana, Ms. Anjay, Prof. Vinod, Dr. Wei Han, and Prof. Jamuna. Poor academic performance and failure are unfavorable outcomes that should be addressed as early as possible. A recent systematic review of international medical schools reported an attrition rate ranging between 2.4% and 26.2%, making for an average of 11.1%. Meanwhile, a Malaysian study reported that 2.1% to 12.1% of a means of 5.3% of year one medical students enrolled at a public medical school fail to progress to the next stage of their studies. This situation is of particular concern. A comparison of high and low achieving medical students may explain effective and ineffective learning processes, as these students represent the extreme ends of academic achievement. Several quantitative studies have sought to determine the factors that impact academic output by differentiating between high and low achieving students. However, an in-depth qualitative investigation into the learning process, that is a study employing multiple dimensions of how and why learning takes place, is required to explain the differences between high and low achieving students in this respect. Therefore, after recognizing the gaps in the literature and realizing that some students from our medical school fail while their peers succeed, we decided to explore the differences between the learning processes of high and low achieving medical students at the University Malaya, Malaysia. Accordingly, the following research question guided this study. How did the learning processes between the high and low achieving students differ? This study adopts a theory of action approach to examine the differences between high and low achieving first-year medical student at a Malaysian university. According to the theory of learning approach, human actions are derived from mental variables that consciously or unconsciously govern respective action. These governing variables can be identified through actions or the rationale given for the actions. Actions are based on these governing variables and result in outcomes. Simply put, governing variables, that is, why did I do this, decide the action, what did I do, and the action decide outcomes, what did I get. In order to conduct an in-depth exploration of the learning processes of high and low achieving students, this study adopted a qualitative case study design. More specifically, it constructed and compared two cases, high and low achieving students. A qualitative case study design was utilized because both cases demonstrate a very distinct representation, that is outstanding achievement and marked failure. So comparing these cases is intended to determine both effective and ineffective learning processes. Preclinical, that's year one and year two students who score in the 90th percentile in the professional exams, were identified as high achieving students and invited to meet the researchers. This process was repeated to recruit low achieving students who score in the 10th percentile of the professional exams. Participations was voluntary. And for information, this study was conducted prior, data collections was prior to COVID-19. All right, so this is not a COVID-19 context. We collected data using reflective journals and semi-structured interview. For the reflective journals, we use a Microsoft Word document template that contains a list of questions with a text box provided for each question. The questions were designed according to the Gibbs reflective cycle and intended to encourage participants to reflect on and describe their experiences in the previous academic year. Gibbs reflective cycle enables participants to recall and express their actions and feelings and engage in self-reflections. These details would provide important insight into learning processes. Examples of questions are, what did you think and feel about this study approach? Why? What have you learned from that situation? Why do you think that situations happened? Following the submissions of the reflective journals, semi-structured one-to-one interviews were conducted and guided by the theory of action approach. Interview questions were developed to investigate what action students did in their previous academic year and why. Okay, they did so. Examples of questions are, all right, what did you do before attending teaching activities? And we prompt for examples, and we ask, why did you do so? For data analysis, this study employed thematic analysis to examine the data. So the thematic analysis comprises a set of procedures to identify and describe patterns in the data. Using QDA Minor Light 2.0, two analysts independently search and quote what did students do and why did they do this for year one high achieving student. Discussion then were held to compare the initial codes and solve discrepancies. Using the agreed upon code, the two coders subsequently coded year two high achieving students. Discussions were then held again to verify that there were no newly emergent codes. An identical coding process was applied to analyze year one and year two low achieving students. Once all data were coded, the two analysts compared the codes of high and low achieving students. The two analysts were carefully to avoid a priori fixed and polarized notion that there will be differences. All right, and the third analyst reviewed the coding results to minimize bias. All excerpts were reviewed and to ensure there was no bias in the selections of codes. We use both data, all right, that is reflective journals and interview, and investigators triangulation in this study. And triangulation is conducted to gain an understanding of a phenomenon by using different methods of data to examine the convergence of the information and minimize bias. For the results, data analysis review 4 themes: motivation and expectation, okay, self-management, study methods, and flexibility of mindset. First, high achieving students were more motivated and had higher academic expectations than low achieving students. Second, high achieving students adopted study planning and deep learning approach, whereas low achieving students adopted superficial learning approach. Third, in contrast to low achieving students, high achieving students exhibited better time management and study consistently. And for the fourth theme, high achieving students proactively sought external support and make changes to overcome challenges. In contrast, low achieving students were less resilient and tended to avoid challenges. These differences can be explained using a theory of action framework, which contends that positive action increases the likelihood of attaining favorable academic achievement. For instance, although high-achieving students did not use the term governing variables, they were likely to be governed by intrinsic motivation, a sense of responsibility for themselves and patience, recognitions of their own limitations, and open-mindedness. These positive governing variables are fundamental to intended outcomes for students. That's the good academic achievement. I mean, as governed by these governing variables, high-achieving students then demonstrated following actions. High academic expectations, have study plan, a deep approach to learning, good time management, consistent in study, expose vulnerability, seek support, revised approach to learning. And this process may be called the positive enabling pathway. Correspondingly, negative governing variables may have guided students to act in a way that negatively impacted their academic outcomes. This study found negative actions among low-achieving students that lead to procrastination and acceptance of undesirable outcomes. As governing by these governing variables, low-achieving students demonstrated low academic expectation, do not have study plan, surface approach to learning, poor time management, lack of consistency, avoid showing weakness, do not seek support, avoid confronting challenges. This process may be called negative enabling pathway. More specifically, our study proposed governing variable-based remediation. As per this figure, this remediation is intended to guide low-achieving students to shift from a negative enabling pathway to a positive enabling pathway. It is important that the negative enabling pathway be identified and eliminated. And by replacing negative governing variables with positive governing variables, students will be empowered to actively and identify positive action to achieve an intended outcome. Indeed, the appropriate learning approach has been shown to require less efforts and leads to better outcome, make the proposed remediations more effectively. For instance, if posing positive governing variable, for example, recognitions of self-limitations and open-mindedness, students will actively seek remediations rather than passively waiting for remediations to be offered. So through governing variable-based remediations, students can be taught to identify their own negative enabling pathway and recognize the misalignment of negative governing variables and intended outcomes. This can subsequently work on developing a positive enabling pathway to realign their governing variables and action and their intended outcomes. It may be concluded that interrogating one's governing variables is a process of detecting and correcting errors, and one achievable through guiding or self-reflections on one's actions. It implies that guided reflection may be an appropriate first step of governing variable-based remediation. Particularly, it can serve as a basis for an enable diagnostic tool to support students and facilitators in identifying and eliminating negative governing variables. Our study has several limitations. As you can see, this is a model. So this study constitutes an initial step with future investigation recommended to consolidate and evaluate the model by collecting empirical evidence. In conclusion, based on the theory of action, high-achieving students utilize positive governing variables, whereas low-achieving students are driven by negative governing variables. And therefore, learning improvement for both high and low achieving preclinical medical students should be taken into consideration in order to review their governing variable, which in turn influence their learning processes. Furthermore, low achieving preclinical medical students must interrogate the motive of their actions and realign their positive governing variables, actions, and intended outcomes. With that, thanks for listening. Thank you.